What is Placidyl and how does it work? Placidyl, the brand name for Ethchlorvynol, is a medication that was once prescribed to treat insomnia. Developed in the 1950s by Pfizer, it functioned as a GABAergic agent, enhancing the effects of the neurotransmitter GABA, gamma-aminobutyric acid, in the brain. As a central nervous system depressant, Placidyl was effective in promoting relaxation and sleep. Its sedative and hypnotic properties made it a popular choice for those with severe sleep disturbances. The drug worked by binding to GABA receptors in the brain, increasing inhibitory signals and thus decreasing neuronal activity. This action leads to the drowsy and calming effects that were beneficial for individuals suffering from insomnia. Although Placidyl was once a common prescription, the rise of safer alternatives has led to its decline in use. This decline reflects the medical community's ongoing efforts to balance efficacy with patient safety. What are the common side effects of Placidyl? As with many sedative hypnotics, Placidyl was associated with a range of side effects. Drowsiness, nausea, and disorientation were common, particularly at higher doses. The drug could also cause dependence and withdrawal symptoms, similar to those experienced with benzodiazepines. Long-term use was not recommended, as it could lead to increased tolerance and a need for higher doses to achieve the same effects. Some users reported experiencing hangover-like symptoms the day after use, including grogginess and impaired coordination, which could interfere with daily activities. Healthcare professionals were always cautious when prescribing Placidyl, monitoring patients closely for any adverse reactions. It was essential for users to report any troubling side effects immediately. Is Placidyl still prescribed today? In the United States, Placidyl is no longer prescribed. Its production was discontinued due to concerns over its potential for abuse and the development of safer treatment options for insomnia. However, in some countries, Placidyl can still be obtained legally with a prescription. The availability of the drug is tightly controlled, reflecting its classification as a Schedule IV controlled substance. While its use is rare, the fact that Placidyl can still be prescribed in certain situations highlights the complexity of global drug policies and the need for individualized patient care. What do Placidyl pill images look like? Placidyl pill images reveal capsules that were typically green in color, available in dosages of 200 mg, 500 mg, and 750 mg. These capsules were distinctive in appearance, making them easily identifiable among other medications. It's important to remember, for those seeking to understand what Placidyl looks like, that the drug is no longer in widespread use. Therefore, it is exceedingly rare to encounter legitimate Placidyl pills in the present day. Is Placidyl addictive or habit-forming? Yes, Placidyl had the potential to be habit-forming. The risk of addiction was a significant concern during its period of active use. Users could develop both a physical and psychological dependence on the drug, especially with long-term use. The potential for addiction to Placidyl was comparable to that of other sedative hypnotics, such as benzodiazepines. This similarity is due to their common effects on the central nervous system and neurotransmitters. Understanding the addiction potential of Placidyl is crucial, as misuse can lead to serious health consequences, including overdose. How should Placidyl be taken safely? When Placidyl was still prescribed, it was crucial to take it exactly as directed by a healthcare professional. The medication was intended for short-term use, and patients were advised not to exceed the prescribed dosage or frequency. Safe use of Placidyl also involved avoiding alcohol and other central nervous system depressants, as these could enhance its sedative effects and increase the risk of adverse reactions. Patient education on the proper use and storage of the medication was pivotal to prevent accidental misuse or abuse by others. What are the risks of Placidyl abuse? Abuse of Placidyl carried significant risks, including overdose and death. Symptoms of overdose could include profound sedation, respiratory depression, and coma. Chronic abuse led to a host of problems, such as cognitive impairment, psychological dependence, and severe withdrawal symptoms upon cessation. Due to these risks, the discontinuation of Placidyl in many countries has been seen as a necessary step to protect public health.